We start, though, with these new COVID numbers. A new NBC News tally confirms the U.S. has had more than 36 million COVID cases since the start of the pandemic. And as daily cases hit alarming new highs across the country, pediatric units are filling up with young COVID patients. Now, some doctors in Tennessee are warning of, quote, scary times ahead.
That warning comes as the Pentagon announces it's seeking a vaccine mandate for all U.S. troops by mid-September. But the defense secretary warns that he could push up the deadline, saying, quote, to defend this nation, we need a healthy and ready force. We have a team lined up to cover it all. NBC News Now correspondent Maura Barrett, Pentagon and National Security correspondent Courtney Kuby, and Dr. Amish Adalja. Let's start with Maura, who is in Memphis, Tennessee. Maura, as cases rise in that state, more kids are getting sick. Give us a sense of what the pediatric hospitals there are dealing with right now.
Good morning, Joe. It's a very concerning situation here as the state health department is warning that all children's hospitals across the state could be filled up by the end of this week. Here in Memphis, they've seen about 12 cases in the hospital now, with 6 of them in the ICU. That's of a total of more than 14 ICU cases and 38 active hospitalizations across the entire state. And just here last week, they saw 2 children pass away. Week over week, they've seen a 65% increase in pediatric cases. So obviously this all comes as kids are going back to school. The Delta variant is raging through the country, and vaccination rates here in Tennessee are very low. When you look at the numbers, kids aged 12 to 17 only make up about 17% of that age group is fully vaccinated right now. So that's a very concerning situation that doctors are looking at as we work ahead coming into the fall.
Some context here. The state health department there had paused vaccine outreach to minors for most of the month of July after an intense pushback from Republican lawmakers. Tell us more about that, and where do vaccinations stand right now in Tennessee?
Right, Joe, this has been a political battle across many states, but here in Tennessee in particular, most recently when it comes to mask mandates in schools. But that outreach was because the pause in the outreach was because of Republican pushback from the state house. They paused any social media outreach, any vaccine events that were happening on school grounds. And obviously in the summer, if you're not reaching out to kids via social media, how are you reaching them at all, right? And so they've reinstated that now that school is starting back up. But doctors at the health department tell me that this was definitely a damper in what the efforts that they could have made in getting kids vaccinated before they get back to school this month. And
Maura, with school back in session, I know you spoke to some parents about heading back to the classroom. What did they tell you?
I spent the day at Memphis's first day of school yesterday speaking to parents and students here in Memphis and Shelby County. They're seeing a major spike in cases, a 200% increase over the last few weeks. And so school officials here made the decision to instate that mask mandate against the wishes of the Republican Governor Bill Lee here. I wanted to hear from some of the parents I spoke to about their support of the local school district's decision.
Mask mandate is something that I feel that is very required. Like I said, due to the fact of this COVID thing that's going on, I really feel that everybody should wear their mask. Like I said, safety is the key. And with the mask, I feel like it does help.
I feel like that's going to be a great thing because that is kind of like the first defense against the virus that's going on. So the mask mandate, I think everyone should be able to wear them to keep everybody safe.
Now, the parents I spoke to did express concern considering kids 12 and under can't get the vaccine, the Delta variant affecting them a lot more now. But they said that the fact that this mask mandate is in place is really reassuring because they want their kids back in school full-time in person. I also spoke to some students that basically said they would do anything necessary, even if the mask is inconvenient. They want to be in school full-time throughout the year, and so they're ready to take those precautions as needed, Joe.
Conversation happening in schools and homes across the country right now. Maura, thanks so much.
In the push to get more Americans vaccinated, the Defense Department will require all active duty U.S. service members to get the shot. NBC News Pentagon and National Security correspondent Courtney Kuby is with us. Good morning, Courtney. So first, just give us a sense of how many people we're talking about here. How large is the U.S. military? And then also, how many troops have yet to be vaccinated that would be impacted by this?
So it's all active duty, National Guard and Reserve. So we're talking more than 2 million people, Savannah. But we should caveat that by saying that many of these men and women already have been vaccinated. So when you talk about active duty troops, more than 60% have gotten both shots already, and about a little over 70% have gotten at least one. So again, the majority of these troops have gotten them. It's the National Guard and Reserve that the numbers are a little bit lower, and they vary state to state. But what's important to point out here is this is something we expected. President Biden several weeks ago said that he wanted the Defense Department to look into whether they could make this mandatory for all service members. Secretary Austin, a couple of days later, made it clear that he was not only open, but he intended to do just that after speaking to medical professionals and his joint staff. So it's not a surprise. What we did learn, though, this week is how exactly they're going to implement this. We now know that the Department of Defense will make it a mandatory vaccine for all service members, active duty, National Guard, and Reserve by mid-September. Now, what could actually speed up that timeline is if one of the vaccines, particularly the Pfizer, it moves beyond the emergency authorization and gets full authorization from the FDA. That will speed up the timeline for this to be a mandatory vaccine for all service members.
And now, Courtney, are they expecting blowback? And also, do we know if there's penalties if a service member refuses to get the vaccine?
Savannah, that was the exact question I asked at the briefing after this memo was released yesterday, is what are the implications if service member refuses? You know, you may recall when the anthrax vaccine was made mandatory, it was under an emergency authorization. This is decades ago. And there were service members who refused to take it. At the time, some of them were dishonorably discharged. They were kicked out of the military. We do not expect that to happen in this case, but we just don't have those answers yet. One of the big differences here is by the time this is mandatory, there's a very good chance it will have full authorization from the FDA. So it will be a more difficult argument for the service members to make that that they're being used as guinea pigs. That's one of the arguments that we've seen in the past when service members are required to get a vaccine that's not fully authorized by the FDA. That probably won't be the case here by the time this is actually made mandatory. You know, we got to point out there are 17 vaccines that service members are required to get. This isn't really new. There are many that they have to get just to go to boot camp alone. So the big question is how many people, if any, will really push back on this new mandatory vaccine? And we just don't know yet, Savannah.
And now, Courtney, there was actually some initial confusion after Secretary Austin's memo about that mid-September deadline that you mentioned. So walk us through the timing of this vaccine requirement and then what has to happen for the Pentagon to be able to mandate it and enforce it.
So there was some confusion. I mean, the memo is actually pretty clear, but there was a news report that came out right before the memo was released that caused a lot of confusion, saying that all service members had to be vaccinated by mid-September, when the reality is it will become mandatory by mid-September. But then, of course, as you all know, it can take up to 5 weeks before someone is fully vaccinated. So they'll have some time after that, and each service will have their own implementation plan. So, you know, some of them may give them service members several months. But what we do know is that by mid-September, at the latest, it will become mandatory for all service members. And the remainder of these, you know, up to 2 million people will be required to get these vaccines, you know, in the coming days and weeks.
All right, Courtney, thank you so much for your reporting here.
Let's bring in Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Doctor, good to have you with us. So first of all, what is your reaction to what we're just discussing there, the Pentagon's announcement that it will mandate vaccinations for troops?
This is a good development. We want our military to be the most resilient to COVID-19, and this is really something about, you know, their workforce, their military force being able to withstand COVID, to be minimally disrupted by COVID. And the best way to do that is to add this to the list of mandatory vaccines that the military gets. And I think that this is a long since coming. I think it should have been something that was done even earlier. And I think more organizations should follow the example of the military and certain hospitals and certain companies by mandating the vaccine as a condition of employment.
A few minutes ago, Maura Barrett laid out the dire situation there in Memphis. Other pediatric hospitals across the country are also starting to get overwhelmed. I guess the question a lot of parents are asking, what is the answer? Is it a return to virtual learning, or is there a safe way to do in-person classes this fall?
There definitely is a safe way to do in-person schooling. We could even do in-person schooling in the pre-vaccine era. We have great lessons of how to do this. What needs to be done is we've got to get the vaccination numbers as high as possible in the communities amongst the teachers. I encourage school boards and school districts to mandate the vaccine for teachers, and we need to get as many children vaccinated as possible that are eligible to be vaccinated. We also need to have other mitigation measures in schools in terms of the way desks are organized. And specifically, we need attention to extracurricular activities, because it wasn't actually the learning and sitting in a desk that was causing people to get infected in schools in the pre-vaccine era. It was the extracurricular activities, sports and dances and all of those other types of activities surrounding school. That's what we have to really be more careful about. But it's easier to do this now than it was in the past because we've got so many people vaccinated. So this has to be something that we prioritize, because even though we do see some children become seriously ill with COVID-19, that's not the norm. And a lot of children were hurt not because of what the virus did to them, but because of what adults did to them by making virtual learning the norm for the school year.
And Dr. Adelja, we should also talk about travel. The CDC is warning against travel to several countries. That includes Israel, France, and Thailand because of rising COVID cases. So if someone does, for any reason, have an international trip booked to one of those spots, what's your advice?
Well, if you're somebody that's fully vaccinated, you have to remember that the vaccines are going to hold up really well. You're going to be protected from serious illness, hospitalization, and death. But if you're not vaccinated, or if you're somebody that's immunocompromised, who the vaccine might not have worked as well, you have to realize that you're going to come into contact with this virus, and you may want to take more precautions. You might want to do testing. So it's going to be something that's going to really be dictated by your risk tolerance and what your vaccination status is.
All right. Dr. Adelja, as always, thanks so much. Appreciate it.
There's more fallout this morning in the scandal surrounding New York Governor Andrew Cuomo. Roberta Kaplan stepped down as chairwoman of Time's Up, an organization battling workplace sexual harassment, after the Attorney General's report on Cuomo alleged she counseled the governor when an advisor accused him of sexual harassment last year. The New York State Assembly began an impeachment probe into the governor's alleged conduct. Cuomo has not been charged with the crime and disputes many of the allegations. Joining us from the New York State Capitol in Albany is MSNBC anchor Lindsay Reiser. Lindsay, good morning. So this is now actually the second major resignation in Cuomo's circle this morning. What do we know about this one and why she stepped down?
Well, she was implicated in the AG report that was just released, Savannah. And according to that report, she reviewed an op-ed that was never published that was disparaging against one of Cuomo's first accusers, Lindsay Boylan. And she announced her resignation in a statement yesterday. I'm going to read part of that. We're going to show you also part of it on your screen, saying, I therefore have reluctantly come to the conclusion that an active litigation practice is no longer compatible with serving on the board at Time's Up at this time, and I hereby resign. Now, she hasn't responded to a request from NBC News for comment, but this announcement comes after 40 victims and survivors of sexual harassment and assault wrote a letter that was published on Medium criticizing Time's Up, saying essentially that they betrayed the very people they're supposed to champion. Time's Up is a gender equality rights organization. They also work to protect and prevent sexual harassment and assault, and they say they're looking within, Savannah.
And Lindsay, some other new information we have here is from a CBS News interview that aired with Brittany Camisa, one of the women accusing the governor of harassment. First, let's listen to part of what she said.
Maybe to him that he thought this was normal, but to me and the other women that he did this to, it was not normal. It was not welcomed, and it was certainly not consensual.
So how is the governor's legal team handling this public allegation?
By categorically denying it. We know that Cuomo's attorney has said that there are factual errors about important evidence in the AG report that were completely omitted. And this is what she told my colleague Ayman Mohyeldin on MSNBC yesterday about Brittany Camisa specifically.
The governor has made clear in his testimony to the Attorney General's investigators, he doesn't dispute some of the allegations. With respect to Brittany Camisa, it just did not happen.
And she also says we can expect to hear from the governor soon, Savannah.
And Lindsay, how soon could the New York State Assembly work through its impeachment probe of Governor Cuomo? Do we have any idea of a timeline here?
Yeah, we do. I mean, the New York Assembly chairman gave a press conference and he said they want to move quickly with this. They want to be moving with their process by next month. And so keep in mind, these are the things also that they're looking at in this probe, not only the sexual harassment allegations, but Cuomo's book deal, whether he used state resources for that pandemic book that he wrote, nursing home deaths during the pandemic, and whether the governor intervened with maintenance on the Mario Cuomo Bridge. So what the process will look like is there's a key deadline this Friday. That is when the governor has to submit items in his defense to the Judiciary Committee for the State Assembly. And then the State Assembly will present their findings, and they'll decide whether to go on with impeachment. And if they do, the governor has 30 days to respond to that, and then the trial will be in the Senate, Savannah. So they want to give the governor due process here, but they say they also want to move swiftly.
Lindsay, lots of updates there. Thank you so much for covering it all.
It's Infrastructure Day in the Senate. A final vote for the bipartisan bill is finally set for 11 a.m. Eastern on Capitol Hill. The $1 trillion package stretches from the nation's waterways to its airspace. It includes more than $100 billion for roads and bridges, billions for trains, highways, and public transit, even tens of billions for broadband internet. Immediately after today's vote, the Senate will move to the president's next package, a $3.5 trillion human infrastructure bill, legislation that has no Republican support. Speaker Pelosi says in the House she won't put the bipartisan compromise to a vote without this progressive budget deal alongside it. NBC News Capitol Hill correspondent Leanne Caldwell joins us now at the start of what will be a busy day. Leanne, good to see you. So nothing is for sure in the Senate until after the final vote. How likely is it this bipartisan deal will pass, and which Republicans and how many do you think are backing it?
Good morning, Joe. That's right. We never count the votes until all the votes are actually cast, but things are looking extremely good for this bipartisan bill. On a key procedural vote the other night, there were 19 Republicans who voted for that key procedural vote, and that is a strong indication of that many senators at least will vote for final passage. You see that list, including Senate Minority Leader Mitch McConnell siding with the Democrats and his fellow Republicans on this issue, other members of his leadership team. And so things are looking very good that the Senate is going to have a very big bipartisan win, something that the last two presidents, especially former President Trump, who talked about infrastructure all the time, were unable to get done, Joe.
Okay, speaking of not bipartisan, we could be looking at what's called a votorama for the Democratic human infrastructure bill starting today. What could that look like, and are Democrats fully on board with trying to get the bill over the finish line?
Yeah, so this is the first stage in what's going to be a very long process for this $3.5 trillion human infrastructure bill. This is the outline of the legislation, and they have to hold all of these votes today in order to get to that vote. And then after that, then they will write the actual text of the legislation. Now, Democrats are on board with this first stage of the process, but after that, when they get to that writing stage and actually have to vote on details of legislation, then it gets extremely tricky. And that's where moderates and progressives are at odds here. So it's going to be a very difficult task for Democratic leadership to keep their their party in line despite very slim majorities in the House and the Senate, Joe.
Yeah, with that, senators could ask for as many amendments as they want for the votorama. How does that part of the process impact the final version of the bill?
Well, it actually doesn't impact it at all at this stage. But what these amendments do, we could see 3-4 dozen amendments voted on today. And most of them are political statements trying to make Democrats take very difficult votes, and also political statements for Republicans, especially who who have higher ambitions or other ambitions, including people like Senator Josh Hawley, who wants a vote on adding 100,000 police officers, also banning critical race theory. We know Josh Hawley has presidential ambitions. So this is a very political process over the next 24 hours that actually will not impact the underlying budget resolution, this process that is beginning this reconciliation process, Joe.
All right. Votorama sounds more exciting than it really is. Yeah. Thanks so much.
Thousands of residents in 8 Northern California counties are still under evacuation orders as the Dixie Fire threatens the area.
The historic fire has already destroyed much of the town of Greenville, and firefighters are concerned it could get even worse with more hot, dry weather expected in the week ahead. NBC News correspondent Steve Patterson reports from California.
Yeah, Joe, Savannah, good morning. The Dixie Fire, now the second largest wildfire in California history, and it is still growing. There are two fronts of this fire. Thankfully, this weekend, the winds died down significantly, the temperatures cooled down, but now heading on into the week, there is the chance that this heat wave could bring more extremely hot temperatures and more of these red flag winds. That is when the fire moves to a new location. That's exactly what firefighters are worried about. They've been trying to put down protection on homes so there's not another scenario just like this one here in Greenville, where 75% of all structures were decimated, where people now are worried about returning to their homes. We started to see some of the first vestiges of life come back here. There are actually teams of citizens who know the town very well to do things like shutting off water in people's properties to make sure they can assess the damage in some of the places that have burned down, sort of like advanced teams in town here. But meanwhile, the heartbreak remains. We spoke to a firefighter just about covering a fire this massive, the heartbreak they see on the front lines, especially in a situation like this.
Sure, it does take an emotional toll, but they also know that we have a mission to do. There is always another town, there is always another home, and so while it hurts our hearts to see those homes and towns and livelihoods destroyed, we also know that we have a job to do, and that means, marching on to the next area to try to protect it.
And the historic nature of a fire this size is almost unbelievable. 30,000 people displaced from their homes, 600 structures torn apart, and still some 13,000 homes in the threat zone here as firefighters do all they can to battle back. Guys, back to you.
All right, thank you, Steve.
It's okay, though.
Let's get a closer look at this dangerous heat wave on the West Coast and some other extreme weather last night in Illinois.
Yeah, hi, Bill Cairns. I know you have that and our Morning News Now forecast. Good morning.
Yeah, good morning. A lot going on with these heat waves, the fires. Now we got the tropics starting to heat up. So let's get into it first. Let's get into this heat wave. We have a lot of people in this country that are under heat advisories, warnings, or watches. It's almost roughly 1 in every 3 Americans, which is a crazy number. So 94 million people in the middle of the country and all the way into the Northeast are under these heat warnings and advisories. The Northeast is beginning to heat up. Your heat wave begins today in some areas and continues through the end of the week. The middle of the country, it's been hot. It's the dog days of summer. It's going to stay that way. And in the Northwest, get ready. The heat is beginning today. It peaks Thursday and Friday in many areas, then kind of get a little relief towards Saturday. But another record-breaking heat wave is heading your way. So how hot will it be today? The number in blue is the actual temperature in the shade. The number in white is how warm it will feel in the shade. That's because you factor in the humidity. So notice that St. Louis and Memphis and Tulsa, that's just kind of soupy, gross, humid air. In the Northeast, beginning to heat up. Syracuse, D.C., and Charlotte all approaching 100. By Wednesday, even New York City will start to feel like 100. Notice Rochester, 102. Still very hot in areas of the Midwest. The difference is that at least some areas of the Northeast will cool off a little bit by the time we get into Saturday. And how about the tropics, too, guys? This is heading towards the peak of the hurricane season. We are expecting a tropical storm to be named later today. It will likely be called Tropical Storm Fred. We already have tropical storm warnings for Puerto Rico and the Virgin Islands. And this one will be moving pretty quickly over the next couple of days. We do think it's going to have some land interaction with Haiti and the Dominican Republic, and Cuba should weaken it. But notice that increase in intensity when it gets to the Florida Straits. This is going to be Saturday morning and then during the weekend. So we have to watch out Miami, Orlando, Tampa, all of Florida for the most part. And then if this does intensify, it could be during the day on Sunday, too. So, guys, an interesting forecast. You never give up on these storms until they're completely gone. This one should be weak and then getting stronger as it approaches the U.S. this weekend. So active weather for sure.
All right. We know you'll keep an eye on it. Thank you, Bill.
Definitely. For a while now. Thank you.